As a first artery, from the point which I mentioned, epigastrica superficialis continues to the umbilicus. Pudenda externa, from the same point which I mentioned, come to the tuber pubica. Circumflexa ilus superficialis, from the point which I mentioned, come to the anterior superior iliac scapula. So remember, please, this is, by the way, same vessels we will study and in abdominal region. Because as I say, they come to anterior abdominal wall and they supply here the structures. Little bit about nerves, which we have here. You know, most complicated innervation we have in the medial surface of the thigh. And I think you will be agree with me, because I think in your life you feel that the most sensitivity you have especially in the medial surface, not so much in the lateral surface. And what is important, each third of the medial surface of the thigh have its specific innervation. Let's start from upper third. Of course, now I speak about the sensory innervation because we discuss subcutaneous fatty tissue. Upper third, three nerves. Nervus ilioinguinalis, nervus iliohypogastrica, and ramus femoralis, nervi gende femoralis. All these mentioned nerves originated from the lumbar plexus. All these mentioned nerves make the sensory innervation of the medial surface of the skin. Middle third, here we have the skin branch of obturator nerve. Nervus obturatorius also, it is from lumbar plexus. Unfortunately, I don't take today the model of the pelvis, but I want to remind you that in the pelvis anteriorly, there are the aperture, which we call foramen obturatorium. Along the upper margin of this foramen, between obturator membrane and between the bones, it is the pubic bones, we have formation of the channel. This channel we call obturator channel, canalis obturatorius. It contains obturator vessels, which is the branches of the internal iliac artery, and they contain nervus obturatorius, which is from lumbar plex. Nervus obturatorius by itself doesn't come to the fatty tissue. It goes to the muscles, which is located in the medial compartment. What is medial compartment? I will tell you a little after. Here we have adductor muscles, and it is the innervation of this adductor muscle. But it leaves one skin branch, which has come to the middle third of the medial surface and make innervation of it. Finally, lower third, so we say three nerves in upper third of medial surface, one nerve in middle third, and we come to the lower third. Lower third of the skin, here, innervated by branch of nervus femoralis. By the way, longest branch of nervus femoralis, which we call nervus saphenus. I want to remind you again, anatomy that in upper third of the thigh region, nervus femoralis is finished. By the way, that is greatly visible, for example, in this picture. You can see how three big structures from medial to lateral, vena femoralis, arteria femoralis, and nervus femoralis, from subinguinal region come to the femoral region. By the way, in the femoral region, they are located in the medial interfacial space. And upper third of medial interfacial space we call femoral triangle. Remember, please, medial interfacial space in each third has specific name. In the upper third, we call it femoral triangle. In the middle third, we call it anterior femoral groove. In the lower third, we call it Hunter's or adductor's channel. Why I remember now about it? Because as you can see in upper third, this yellow structure split it into very many branches, and it is finished inside of the upper third. And the longest branch of femoral nerve descending to down, and in the lower third of the fatty tissue, it is innervating the medial surface of the thigh. By the way, it will reach up to your foot region. But so once again, let's make conclusion. Medial surface in each third has specific innervation. Upper one, three nerves, middle one nerve, lower one, again one nerve. But we have the nerves also in another surfaces. One nerve in anterior surface, one nerve in the lateral surface, and one nerve in the posterior surface. In anterior surface, we have anterior skin nerve of thigh. Again, the branch of this yellow structure which you see. It is branch of nervus femoralis. In the lateral surface, we have lateral skin nerve of thigh region. By the way, immediately in the previous region, which I described, subinguinal, we describe it inside of lacuna musculorum. And it is originated from lumbar plexus. Remember, please, that is not so hard. Majority of nerves which you will see in anterior surface of thigh will be from lumbar plexus. All nerves which you will see in posterior surface of the thigh will be from sacral plexus. That is not hard to remember. Finally, in the back side, we have nervus cutaneus femoralis posterior. We study it together in gluteal region inside of infrapiriformis aperture. As you remember, infrapiriform aperture has two neurovascular bundles and two separate nerves. And one from this nerve, it is nervus cutaneus femoralis posterior. Second one, it is nervus ischiaticus. Along the medial surface of the thigh region, especially below the inguinal ligament, we have superficial lymphatic nodes. Superficial lymphatic nodes drain into deep lymphatic nodes, which is located, as you remember, in subinguinal region, inside of lacuna vasorum, and 3-4 big lymphatic nodes here, we call Rosenmüller-Piragov's lymphatic nodes. These lymphatic nodes, in their turn, goes to upwards, they give the lymphatic vessels, which is perforated transverse fascia and make it cribriform. And we call it internal cribriform fascia. And they drain into the abdominal group of the lymphatic nodes along the inferior caval vein. Is it understandable for you? Brilliant, beautiful. We explain skin, fatty tissue. Superficial fascia doesn't have here any specificity. It's just located in the fat and splitted fat into two layers, superficial and deep. By the way, inside of the deep layer of the fat, we have superficial veins. Much more better to say vein. Because in femoral region, there are one big vein in fatty tissue, which is called vena saphena magna. Vena saphena magna, greatly shown, for example, in this picture. In the medial surface, if you look attentively, you will see this venous structure. By the way, it's greatly visible in the picture that it's originated again from foot region. This is the level of the medial malleolus. And from medial malleolus, because that is the vein, it is ascended to upwards. And finally, immediately below the cap of my marker, otherwise immediately below the medial 1/3 of inguinal ligament, it is perforated proper fascia, forms hiatus saphenous, and drain into the femoral vein, and finished in that level. What is hiatus saphenous, guys? 1 minute, look everybody to me. Now imagine that my white coat, which is covered my lower extremity, it is the proper fascia. I told you 100 times that in the extremities, proper fascia contain double layers. Superficial, which is surrounding extremity, and deep, which gives the intermuscular septus. Intermuscular septus pass between the muscles and fuse with the bone. Intermuscular septus in the region with the single bone. By the way, thigh, it is the region with the single bone. Here we have only femoral bone. Has double layers and contain interfacial space. By the way, in the thigh region, there are 3 intermuscular septus, means 3 interfacial spaces. If in arm region, there are only 2 interfacial spaces, in the thigh region, there are 3 interfacial spaces. Why I remember about it? Because this, my white coat, which has covered my thigh region, in real case, of course, I will not draw, but has the aperture, which is located immediately below the medial 1/3 of the inguinal ligament. This aperture, it is evolutional, embryonal defect of the superficial layer of proper fascia. This aperture you can greatly see in this picture. Look, please here. That is aperture which I described. Do you see this aperture? This aperture is called hiatus saphenous. And this is functionally superficial ring of the femoral channel. By the way, that is the channel which is naturally absent. As you remember, I told you previous time that femoral channel contained 2 rings. By the way, from these 2 rings, deep one located in horizontal plane inside of subinguinal space, it is lacuna vasorum. Superficial ring located in frontal plane, it is thigh region, hiatus saphenous, which you see now. Now please insert your pen between these 2 rings. Yeah, and give me, please, give me. Now the pen which we inserted, by the way, in the normal case, not normal, in the pathological case, of course it should be inserted not from down to up, but should be inserted from up to down. And this pen now modulated for you formation of the femoral hernia. Then the organs protrude from deep ring to the superficial ring. They forms the communication between these 2 rings, and they forms the femoral channel, which is normally absent. Because as you see previously, thank you very much, these 2 rings normally doesn't communicate to each other anyhow. They say normally you have only rings of this channel, but you don't have the channel. You have both rings, one inside of subinguinal space, which is deep ring, second inside of the femoral region, which is superficial ring. But again, I repeat you, these 2 rings doesn't have communication. Communication is happen during protrusion of the organs. And communication forms the femoral channel. Is it understandable for you? Let's say, remember, please, now you see hiatus saphenous, which is superficial ring of the femoral channel, and which is normally, not pathologically, normally have one important structure. This is place of the passage of the veins and lymphatic structures. Biggest vein which you see in the picture, we call vena saphena magna. How you projected vena saphena magna in fatty tissue? Look please here. In the normal anatomical position of your patient, you make imaginary line which is connected anterior margin of the medial malleolus with the midpoint of your inguinal ligament. Once again, imaginary line between anterior margin of medial malleolus up to the midpoint of the inguinal ligament, again in normal anatomical position. If you will make flexion in 2 joints, hip joint, knee joint, and will make external rotation of extremity, same line will project it arteria femoralis. Same line between anterior margin of the medial malleolus and midpoint, but in special position of the lower extremity. Again, flexion in 2 joints and external rotation. So you can see line is same, but projectional structures is different because of different position of the extremity. We finished to speak about superficial structure. So remember, please, in fatty tissue we have superficial nerves and we have superficial veins. There are also arteries, I agree with you, which I describe like exceptional structures, but they doesn't have any function, again I tell you, in the femoral region. They just transitory from femoral region, continues into the upwards located abdominal region and supply the structures in the abdomen. Now we discussed together 3 layers. Now immediately we will start to make our diagrams. And we come to the most important layer nowadays for you. It is the proper fascia. As I say, your proper fascia contains double layer, superficial and deep. Superficial layer we call broad fascia, fascia lata. Superficial layer cover the region of the thigh from outside. That is this white transparent layer which is located under the vessels in this picture. Superficial layer have defect which I described you several minutes before. And now attract your attention into the lateral portion of this superficial layer of proper fascia. Yesterday, then we discussed the gluteal region. We spoke about this portion, and as you remember, we call it tractus iliotibialis. What is the specificity of it? It is white, much more whiter than in other parts, and it's not transparent. It means it is very thick. It has aponeurotical structure. What is anatomical reason of its formation? I told you that this is part of proper fascia, which is fused with two tendons. That is tendon of the muscle which is tends the proper fascia. We call it musculus tensor fascillaris. And it is part of the ligaments of gluteus maximus tendon. Due to junction with these two tendons, proper fascia become very thick. And it is continuous from anterior superior iliac spine up to the level of tuberositas jardi. What is tuberositas jardi? If you will put your fingers into uppermost part of the tibia, epiphyse of the tibia, immediately in midpoint, you will palpate the tuberositas tibia. Between tuberositas tibia and head of the fibula, there are second protrusion, which we call Jardis tuberositas. That's why you find it, tuberositas tibia, you palpate it head of the fibula, and you find the midpoint of distance between them. Say tractus iliotibialis pass from anterior superior spine up to the Jardi tuberositas and fuse finish here. Well, the function of this structure, I told you before, it makes compression of the broad fascia and press the venous blood from up to down. It's help the venous drainage of the lower extremity. Deep layer of the proper fascia, as I told you before, gives intermuscular septum. Now, write the name of the diagram. Cross-section of the upper third of the thigh region. Let's choose together the extremity. I suggest you to take the right one. If it will be right one for me, that side will be medial, this side will be the lateral one. Yeah, that's why I put here M. Here I put the L. And draw absolutely round figure in my blackboard, and it will be proper fascia. Oh, let's start from skin if you want. For me, it doesn't matter. Let's start from skin. Because that is the skin, which is described for you. Inside of it, I draw the second rib, and it will be the proper fascia, structure number 3. And between structure 1 and 3, we have structure number 2, which we call subcutaneous fatty tissue. Let's say number 1, it is skin, number 2, it is fatty tissue, number 3, it is proper tissue. Finally, in mid-side of our diagram, draw please link number 4, it will be the femoral bone. In upper third, it is the epiphyse of it. And very, very quickly, let's put the superficial structures. In the medial side, please draw 3 small rings. In our picture, that will be structure 5. Right, please, 3 superficial nerves. I told you before the names. It is the ilia inguinalis, ilia hypogastrica, and ramus femoralis, nervi genita femoralis. Nervus ilio inguinalis, ilio hypogastrica, and ramus genitalis, ramus femoralis, nervi genita femoralis. A little bit laterally to the put 3 another points and put the number 6 and call them 3 arteries. It is epigastrica superficialis, circumflexa ilis superficialis, and pudenta externa. As I told you, this is the branches of the femoral artery. In the fatty tissue in midpoint, immediately draw 1 big point. This big point will be structure number 7. Call it please vena saphenous magna. It is come to the mid side, yeah, by its hiatus saphenous, as you remember, it is drawn into the femoral vein, not finish it. A little bit deep to structure 7. Draw 1 more point, structure 8. And in lateral side, 1 more point, 9. and posteriorly 10. This is 3 superficial nerves. 8 structure we call anterior femoral nerve, anterior femoral skin nerve, nervus cutaneus femoralis anterior. 9 it is nervus cutaneus femoralis lateralis, and 10 it is nervus cutaneus femoralis posterior. If you want, you can write origin 8, one originated from the femoral nerve, 9 it is branch of the lumbar plexus, and 10 it is branch of the sacral plexus. 10 it is part of the sacral plexus. Is it understandable for you? Very well, let's continue. We finished to draw the superficial vessels and nerves, but we don't finish to draw superficial structures. Now please look to me. In the lateral side, I make the proper fascia very thick. This will be structure 11 in my picture, which is called tractus iliotibialis. You remember, we say that in the lateral portion, proper fascia is very thick. And also I will draw small superficial muscle, muscle number 12, which is finished in upper third, by the way, and which is called musculus tensor fasciator. Musculus tensor fasciator. I cannot draw for this muscle the capsule here because I don't have color choice. But for yourself, write please that the superficial muscle, like a second superficial muscle, which is located more medially, muscle number 20 in our picture, and which is called musculus sartorius. It's also covered by proper fascia. Both these muscles covered by the proper fascia. But for both these muscles, in the brackets write please, they located in subcutaneous fatty tissue. That's why we call these muscles superficial muscles. They located in subcutaneous fatty tissue. That's why we call them superficial muscles. One minute attention in the picture. That is our sartorius muscle. I think I have it much more better shown here. Yeah, sartorius, which is cut it here. You can see upper portion, you can see lower portion, and it is passed from up to down, from laterally to the medial side. By the way, little after we will draw the femoral triangle, lateral border of which forms immediately by this muscle, musculus sartorius. Okay? I finished to draw the structures in subcutaneous fatty tissue. Now, the time to draw deep layer of the proper fascia. And as I say you before, deep layer of the proper fascia gives not 2, but 3 intermuscular septa. By the way, posterior one, 1A is medial, B is lateral, and C is posterior. And you can see that C doesn't fuse with the bone. It is finished in the thickness of the muscles. A and B fuse by the medial and lateral margins of the femoral bone, linea aspera so-called, yeah, medialis lateralis, but posterior one no. Posterior one finish inside of the muscles and doesn't join to the bone. Inside of each intermuscular septa, you can see same name space. A contains medial interfacial space, B contains lateral interfacial space, and C contains posterior interfacial space. Remember a body. And between these intermuscular septa, now let's draw so-called osteofacial compartment 1, osteofacial compartment 2, and osteofacial compartment 3. Let's say you can see that we have not only interfacial spaces, but we have also osteofacial compartments. One we call anterior compartment, or otherwise functionally we call it extensors compartment. 2 we call medial compartment or adductors compartment. and 3 we call posterior compartment, all flexors compartment. Is it understandable for you? Very well. Let's continue. Now for yourself, write and remember, please. Now you can see in my cross section 6 spaces, 3 interfacial spaces, and 3 osteofacial compartments. Now open the brackets and write, please. Osteofacial compartment 1 and 2, together with interfacial space A and B, included in anterior thigh region. Osteofacial compartment 3, together with space C, included in posterior thigh region. I think it is not hard to understand. Let's agree. Once again, from 6 compartments, 4 included in anterior thigh, it is 1 and 2, A and B. And only 2 is included in posterior thigh region. It is 3 and C. Is it understandable for you? Super, brilliant. Now, let's start to draw structures inside of these compartments. And first of all, write, please, for you, space A, we call medial interfacial space. And in each third of thigh, it has specific name. Immediately in this picture, we call it femoral triangle. So space A in upper third of thigh region, our picture is upper third, yeah? We call femoral triangle. By the way, look to me. Now inside of space B and inside of space C, I draw just these crossing lines. It means they contain only loose connective tissue. By the way, in all thigh region. Otherwise, we can call them empty spaces. As I mean neurovascular bundle located in space A, and in upper, and in middle, and in lower third. And immediately in upper third, we call it femoral triangle. What does it mean? Now look to me, don't sleep, please. Then you look to the cross section, the space is shown for you really like triangle, which I draw now for you. Then you look to the frontal section. Instead of such kind of the structure, you see that structure, which is shown now in the picture, and which is called femoral triangle. It has such kind of the direction. What is my 2 hands? It is 2 layers of interfacial space, which goes to the linea aspera and fused with it. That's in the cross section, that is the form of the space. In the frontal plane, this is the form of the space. So we call it femoral triangle. Do you understand me or not? Now attract your attention into the picture. What do you see? Which structures border this femoral triangle? From upwards, you can see inguinal ligament. From the laterally, you can see musculus sartorius. And from medial side, you can see the long adductor muscle. Adductor muscles are located here. Is it understandable for you? Yes, once again, upwards we have inguinal ligament, laterally you have sartorius muscle, and medially you have the long adductor muscle. By the way, inside of this triangle, floor of this triangle, also forms by 2 muscles. Look to me, please. It forms by 2 muscles. One from these muscles, you know very well. It is musculus iliopsoas. Yesterday, then we spoke about the interfacial space. I mentioned that by lacuna musculorum, it is descended into the thigh region, and it will be the lateral portion of the floor of this triangle. Medial portion of the floor of this triangle will be musculus pectineus. Come stand up from that side. Let's have once again, look to me. Floor of this muscle, of this triangle, it is 2 muscles. By the way, both these muscles located only in upper third. Now hold your hands in that way and put your hands in front of my hands. His hands, it is deep layer of the proper fascia, which is formed intermuscular septa and cover these 2 my muscles. Is it understandable for you? Thank you very much. So we modulated now a floor of our triangle. My hands, this is the muscles which is covered. His hands, it is deep layer of the proper fascia, which is called intermuscular septum, and cover my hands. Do you understand it or not? Let's draw these muscles, which is form floor of this triangle, and which is covered the septum. Now look at please. One from these muscles, I will draw in the lateral side. It will be muscle number, what is my last number? 13, muscle number 14, and it calls the musculus iliopsoas. Second muscle, I will draw from the medial side. It will be muscle 15, and it will be called musculus pectineus. The hands of my friend, which we modulated now, it is these deep layers of the proper fascia, which is formed the intermuscular septum. That is my hands, this is his hands. Do you understand me or not?
Yes.
Let's have, remember forever, please, floor of this triangle, that it is presented by two muscles, which is covered by deep layer of the proper fascia. What is the roof of this triangle? This is the roof of this triangle. Look to me. Again, come to me. Now that is my triangle. Now just your hand put in front of my triangle and open the distance between your fingers. His hand, it is the broad fascia. This aperture, it is hiatus saphenous. That's a roof of this triangle is perforated, and it forms superficial ring of the femoral channel. Do you understand it or no? Thank you very much. Friend, you a lot of help me today. Now look please here. Where is the roof? Unfortunately it is very high, I cannot hold my hand. But this is the roof of this triangle. Roof of this triangle presented by superficial layer of proper fascia, which we call broad fascia. And you can see that it contained the defect aperture, which we call hiatus saphenous. I think, guys, it's not hard. We understand what is the floor, we understand what the borders, and we understand what the roof of this triangle. Now let's come to content. Content of this triangle greatly shown in this picture. You can see that from medially to the laterally, we have three elements. Let's draw these elements. They say the most medial structure will be structure number 16. Little bit laterally we have structure 17. And the most lateral structure, it is structure 18. Name 16 it is femoral vein, 17 it is femoral artery, and 18 it is femoral nerve. You can see the arrangement of these structures in the picture. From medial to the lateral side, it is the vein, artery, nerve. V-A-N. Is it understandable for you, friends? That is not so hard. That's how we understand that medial interfacial space, it is place of location of the main neurovascular bundle. And we understand the syncope of the elements. Medially we have vein, laterally to the vein we have the artery, laterally to the artery we have the nerve. By the way, for yourself, write or remember, artery and vein covered by the proper fascia capsule. As you remember, same capsule we have in subinguinal region. Proper fascia form the capsule for the vessels, not for the nerve. Nerve is located outside of this capsule. Is it understandable for you? The lateral wall of this capsule, which is divided vessels from the nerve, we call septa of Gaucher, French surgeon who is first described this capsule. The Gaucher septa. You can ask me now what the importance of it. If you are a surgeon and, for example, you need to make access to the vessels, you must understand that vessels is not opened, located inside of this triangle, vessels covered by fish. And first of all, you must to take, for example, the groove probe. You must to cut the sheet which is covered the vessels to make access, approach into the vessels, for example, to suture or to make some another surgical performance. So remember about, but nerve, no. Nerve is absolutely empty, located, without any coverage inside of this triangle. And what is important, we need attention for me. From these three elements which you see inside of neurovascular bundle, artery, vein, and nerve, artery and vein will continue up to the lower third. Nerve will be finished inside of the upper. Nerve gives here partly muscular branches, partly skin branches, and it is finished inside of the femoral triangle. Below upper third of thigh region, we don't have femoral nerve. It is finished. Is it understandable for you, friends? Now, by clever faces, you move your head and say, we understand, but after you come to the controls and the exams and show absolutely knowledge. So if there are problems, ask me, I will re-explain it again. If no, let's continue. Now, I will not draw it in the picture because my picture is not so big. But I will remind you the pure anatomy. Inside of this femoral triangle, femoral artery gives very important branch, which we call deep femoral artery, arteria profunda femoris. You can ask me, but why it's not good visible? It's visible. If you will look attentively, you will see that artery below inguinal ligament split it into two branches. But what is the mistake of the painter who is drawing? This branch is located not in the frontal, but they located in sagittal plane. Deep branch located behind of femoral artery, and from frontal view it's invisible. Femoral artery closing. As I remember once again, arteria profunda femoris, it is the biggest branch of the femoral artery in upper third. This arteria, now imagine that I am deep femoral artery. Look to me, please. I raise my hands into two sides. My hands we call arteria circumflexa femoralis, medialis and lateralis. I surround the femoral bone from two sides, much more better in back pain. Behind of me there are femoral bone, and they give two branches. One is surrounding the bone from the medial side, second is surrounding the bone from the lateral side. And this, my two hands, is called circumflexa vessels. Circumflexa femoralis medialis, circumflexa femoralis lateralis. Both these, my hands, look again to me, split it into two terminal branches, ramus ascendens and ramus descendens. They say, arteria femoralis gives arteria profunda femoralis. Profunda femoralis gives circumflexa femoralis medialis, circumflexa femoralis lateralis. Each these arteries split it into two terminal branches, ramus ascendens, ramus descendens. What is the importance of that? Ascending vessels reach your gluteal region, and they make mainly anastomosis with inferior gluteal arterial branchings. Descending vessels for the medial side reach the medial compartment and involve supplyment of the muscles. In the lateral side, it's much more longer. Ramus descendens circumflexa femoralis lateralis reach your knee region. And together with 9 another vessels, it forms the collateral network of the knee region. Do you remember physiologically approximately same network which we draw for the cubital region, but in cubital region it forms by 8 vessels, 4 descending, 4 ascending. In the knee region you will see 10 vessels, and one from these vessels descending we call ramus descendens circumflexa femoralis lateralis. This is the branch of the femoral artery, once again, deep femoral branch. Is it understandable for you? Brilliant. If you understand it, we completely finished to speak about vessels. By the way, last what I should mention, that in middle third of the thigh region, these arteria profunda femoris split it into 3 terminal branches. We call it prima, secunda, terza, first, second, third. All of them perforated the proper fascia from medial space come to posterior space, and they supply flexor muscles, which is located in posterior osteofacial compartment. So remember, anterior compartment contains extensors, medial compartment contains adductors. This is adduction. Look to me. This is abduction. During adduction, extremity come to the medial plane. During abduction, it goes far from the medial plane. So in medial side, we have adductor muscles. In the posterior portion, we have flexor muscles. Flexors for knee joint, but in the same time, they work like extensors for hip joint. Let's remember, please, once again, deep branch of femoral artery. In the middle third, split it into 3 terminal branches. They perforated proper fascia, and they come to the posterior compartment and supply flexor muscles. It is so-called perforating branches. Is it understandable for you? Because these terminal branches perforated proper fascia, they partly fused with the proper fascia, and vasoconstriction is absent for these vessels. In case of their traumas, they give very profuse bleeding. They fused with proper fascia, they cannot be properly constricted. That is the cause of the very profuse bleeding in case of traumatization of these 3 terminal arteries, which I mentioned now for you. If you understand it, let's come to the muscles. I will just clean this number 1, 2, 3, because the place is small. And let's draw the muscles inside of the space. Inside of space number 1, you know we have the quadriceps femoris muscle. It contains 4 heads, superficial, 2 from the sides, and 1 from the midpoint. As I don't mistake, my last number is 17, 18, 18, yeah? 19, 20, 21, and 22. This is 4 heads of the quadriceps muscle. Each one has its own name. Number 19 we call rectus femoris. 20, vastus medialis. Vastus, it means wide. Wide muscle. 21, vastus lateralis. And 22, vastus intermedius. Once again, vastus medialis, vastus lateralis, and vastus intermedius. But don't forget that inside of the space, in upper third, there are also muscle 14, which is iliopsoas. Minute attention, I will try to show now for you these muscles. This is the quadriceps femoris. Most superficial portion, it is rectus femoris. Medially, vastus medialis. Laterally, lateralis. Intermedius is between them. I must remove rectus to show it for you. Function of these muscles, look to me, it is extension in the knee joint. In the same time, they make flexion in the hip joint. That's why by knee joint function, we call it extensors compartment. This compartment is extensors compartment. And these muscles, it is the extensors for the knee joint. Is it understandable for you? Super. I am happy. If it is understandable, let's enter inside of the medial space, and I will draw here also some muscles. First of all, one muscle is superficial. In my picture, that is the muscle number 23, if I don't mistake. We call it the musculus gracilis. Little after I will show for you the grace muscle. By the way, here it shows. 1 minute, look to me. This is the grace muscle. Musculus gracilis. Deep to it, I will draw now 3 muscles. 24, 25, and 26. Call them please. 24 we call long adductor. 25 we call big adductor. And 26 we call short adductor muscle. Short adductor muscle. Let's say, guys, same you can see in this picture in the cross section. This is adductors. That is the gracilis muscle, grace muscle. By the way, for short adductor, open the brackets and write, please. Short adductor muscle absent in the lower third. It is absent in the lower third. In the brackets, write, please. Upper third of this compartment contains one more muscle. It is muscle number 14 or 15, sorry. It is musculus pectineus, which is drawn before. Let's say 15 and 14 located only in upper third. In middle and lower thirds, they will be absent. 14 it is musculus iliopsoas, 15 it is musculus pectineus. Is it understandable for you? Super, guys, great, I'm happy. Now let's come to the posterior compartment. And divide it into two portions, and each one into two parts. The lateral portion, put the number 27 with 1 and 27 with 2. In the medial portion, put the number 28 and 29. Now write the name 27 with two heads. It is the biceps femoris. It is long and short heads of it. 28 we call semi-tendinosus. 29 we call semi-membranosus. This is flexor muscles for the knee joint. Semi-tendinosus and semi-membranosus. Now look please to groove which is located between these muscles. This is structure 29 in our picture. 30, okay, let's go there. Name it please, posterior femoral groove. Sulcus femoralis posterior. And immediately inside of this groove, I will draw one very big nerve, which is in upper third located superficially, but from up to down, 1 minute look to the picture, it will go deeper and deeper. Of course, you understand what is it. This is structure 31, which is called nervus ischiadicus, and which is the biggest nerve of human body. Nervus ischiadicus, from the sacral plexus. As you remember previously, we described it in the infrapiriformis aperture of the gluteal region. From gluteal region, it is descending to down under the proper fascia. And finally, in the thigh region, it is come to the posterior groove. From up to down, it goes deeper. Let's say, in the lower parts of the thigh region, it's much more protected than in upper parts, because in upper parts, as you can see, it has superficial position. Do you have any questions about this picture? If no questions, guys, now let's clean it. As you remember, you draw the skeleton of this picture, yeah? Before I will make improvement. And write the name, the cross-section of middle third. Cross-section of middle third.